Hi viewers, welcome back. In today's video, we are going to talk about urinary incontinence. So what is urinary incontinence? It is nothing but the involuntary passage of urine. So involuntary passage of urine without knowing, or sometimes because of mild activity like laughing, coughing, sneezing, all these activities can cause incontinence. The mother will pass urine unknowingly. Okay, so we term this as an urinary incontinence, which is one of the major complication in the postnatal period. When we come to the factors that is causing urinary retention, the main factor is the muscles. The muscles become very loose after the delivery of the baby. Okay, so the pelvic muscles, the urethral muscles, all these muscles become very loose once the baby is getting delivered, and because of that there may not be an adequate sphincter control over this urinary bladder to control the urinary flow. This is the main reason why urinary retention or the urinary incontinence is taking place after the delivery of the baby. And then comes the involution of uterus. So you know, when there is involution of uterus, the uterus directly goes and sits over the bladder, and the pressure of the uterus, that is like contracted uterus sitting on the bladder, what happens? There will be lot of pressure over the bladder, and because of that there may be an incontinence. And then we have hormonal changes. So what happens when there is an hormonal changes? Now again you will have your hormones which is causing relaxation of the smooth muscles. So when there is a lot of relaxation with the smooth muscles, what happens? There will be an incontinence of urine. So the factors causing urinary incontinence are weakened muscles, involution of uterus, and the hormonal changes. This is a minor condition, and many mothers face this condition. Like as soon as the delivery is over, many mothers they complain of incontinence, but it is a minor condition. It is treated very easily. So the management is your Kegel's exercise. What is Kegel exercise? Okay, so it is nothing but it is the contraction and the relaxation exercise. So what are we going to do in this exercise? You can give any position to the mother which is comfortable. So either she can sit, stand, anytime she can do, not only in the morning or night, anytime. So whenever she is comfortable, whenever she remembers, she can do this exercise. What she has to do? So tell the mother hold the urinary sphincters as though she is going to hold the urine when she is passing. Okay, so when she is passing urine, at that time she will hold tightly. Similarly, she has to hold the urine and then she has to relax. So hold, relax, hold, relax. So this is the way she has to train up the muscles. So in this way, when she is training up the muscles, they will regain their strength back. So at that time, this becomes a normal problem. Then comes the bladder training program. So what is this bladder training? You are making the bladder to have a regular habit. That is you are telling the bladder that every half an hourly the bladder has to pass urine. So that is what you have to tell. Without the patient is having the urge to pass urine, they have to go to the restroom. Tell them every half an hourly they have to go and empty their bladder. So this will become an habit for the bladder. So it knows whenever it is getting filled up, it has to evacuate like that. So you are going to train the bladder, which is also a very effective process during this incontinence. And then avoid constipation. So when there is constipation to the mother, what happens? The bowel, again with the fecal matter, it directly presses or it sits over the bladder. So when it is sitting over the bladder, what happens? Again there is too much of pressure over the bladder, and because of that there may be an incontinence. That also you have to see. And there must be dietary modification. So what modifications you have to do with the diet? First of all, you have to tell the mother they have to avoid some products which are going to irritate the urinary bladder. What are these products? Coffee, tea, like spicy items, and like some foods like which can cause or irritate the urinary bladder. These foods like you have to avoid, very like fried items, spicy items, all these things you have to tell the mother to avoid. And she has to drink lots of water, that is like around 2 to 3 liters of water she has to consume daily, so that the like bladder is getting trained up and it is getting washed when there is any infection. So this is like one more step. And then in case if the mother is unable to control this incontinence, she can go in for pads, or and also you can tell this crossover, like crossing over of the legs, that is like whenever she is like laughing, coughing, all the times, at that time she can just cross over her legs, so which can decrease the incontinence spells. Okay. So with this we complete urinary incontinence during the puerperal period, where we have discussed the causes and the management in detail. Okay. Hope you understood the class. In case if you have any doubts or any topics, particularly if you want, then you have to comment in the comment box. Till then, we meet in the next class. Take care. Bye.